Hi, doctor. So I just wanted to present to you the last patient that I just saw. All right, this is Mrs. Wells. She's a 28-year-old African American female. She came into the office for a complaint of asthma exacerbations. She actually was diagnosed about 2.5 years ago, and she recently visited her cousin's house where there were cats involved, and therefore I believe that's where the exacerbation began. She reports of dry cough at nighttime. When she lays supine at night, it worsens. The symptoms do worsen. Uh, so she does have expiratory wheezing, a little shortness of breath, and she does use an albuterol inhaler, which has been working well up until recently. But she reports that the albuterol inhaler is no longer working, and it's no longer as effective as it was previously. So she's got the wheezing is about 6 out of 10. The shortness of breath is about an 8 out of 10. She's breathing well at the moment, so there's no active distress. All right, I did do a physical examination, and tactile phragmitis is intact. There's no dullness. Symmetry, bilateral expansion is there. She does have the expiratory wheezing, like I mentioned to you, and there are no crackles. Okay, which is good. It's actually interfering with her ADLs recently, so it's a little bit of a concern. So I do notice that there is no recent spirometry testing. There are no recorded attacks. She does not use a nebulizer or a vaporizer, which I'm already, thinking perhaps a vaporizer at home might help her out. I'm also thinking possibly a consultation to an allergist, just to see if there are anything that she can be aware of to stay away from. Although right now there are no reported allergens at home per her report. Last hospitalization was about 16 years old for breathing problems, total of about 5 times. Again, so denies history of tobacco, no illicit drugs, no alcohol. She did report using marijuana, which was about a couple of times up until about the age of 21. So no major concerns there. What I'm also thinking, and if you can give me your opinion, is perhaps changing from the albuterol to using a combination of ICS, the inhaled control steroids, along with like a LABA. So I'm thinking Symbicort, perhaps, so that we can not just treat the acute symptoms, but do prevention symptoms. That's kind of what I'm thinking. So if you could just let me know if you have any other thoughts, let me know. And all these recommendations are based on NAEPP guidelines. What do you think, doctor?